Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin shortly. Dr. Garza will take questions that have been submitted by members of the media after he makes brief remarks. Reporters who have questions during the briefing may also submit those to the Task Force Public Information contacts, and we will attempt to address them during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Okay, thank you and good afternoon, everybody. Thanks for joining us again today. And it's a beautiful Friday afternoon. To those who are preparing for the weekend, I hope you can relax, enjoy some time in the weather in a safe and very socially distant way. To those who are going to be working this weekend, our thanks. We know that you're doing things that are essential to keep us safe and healthy and keep our community moving, and we very much appreciate your service and sacrifice. So let's go ahead and move on to some of our data here. So I'm going to start again today with our 7-day moving average, which is where I'm going to start with our slides, with our data slides going forward. So the number of COVID patients and the patients under investigation that are in our hospitals today is around 654, which is down from yesterday's number of 685, so quite a significant decline. And as I mentioned yesterday, if you look at the graph here, the line after coming up from earlier this month, or actually last month now, in April, it has really become flattened, which is good. We're hoping for a steeper decline as time goes on, but we're also encouraged that the line isn't going up. So the flattening is good. We're going to have to see how the data progresses from here going forward. So that's our 7-day moving average on our hospital census. Now today here are our hospital numbers. And again, as I mentioned, we have 654 patients under investigation as well as COVID positive patients. And that is down from 685 yesterday. So again, positive numbers. We know that they fluctuate daily, and we're really going to be looking at the trends more so than those daily numbers, but we'll take those wins when we can get them. There are 164 patients in the intensive care unit today, which is the same as yesterday. And then there are 112 patients on ventilators today, which is down from 117 yesterday, so more good news. As I've reported in the past, there's 60 COVID patients discharged yesterday. That brings us to 1,320 patients that have been discharged from our hospital since we first confirmed a positive COVID patient in the metropolitan area. And that's really exciting to see that large of a number of patients being discharged. And that's really a compliment to our amazing healthcare workers for caring so tirelessly for the patients and to everyone's efforts to flatten the curve and allow our healthcare workers to do their jobs and to do them well. So lastly, as we head into the weekend, I just want to ask everybody again to practice social distancing, hand washing, cleaning surfaces, all of those evidence-based practices that are key to keeping transmission low. We have done a fantastic job for the last 6 weeks, and we just need to continue it for a little bit longer until we can start seeing those cases starting to drop. As we said from the start, we need to stop spread, and that will save lives. And it's absolutely apparent to me that we've done a fantastic job of stopping that spread, and I believe unequivocally that we've saved lives in the community because of that. Everyone's sacrifice and dedication throughout this crisis is really what brought the transmission rate down. And again, we've shown the country what St. Louis can do. And we need to keep that up moving forward. And it gives us confidence as we begin to plan for that safe, gradual reopening of the economy. This really makes that possible. So please be safe this weekend. And now I'd be happy to address any questions from the media.
Anecdotally, this reporter says they're hearing some people are being told they have to wait up to 3 weeks to be tested. Are there problems that arise from having potentially symptomatic people wait so long before getting an up or down verdict or result?
Well, there's certainly issues if we can't get if we can't test symptomatic people right away. So the answer is yes if people have to wait to get tested. But what I would say is the clinics that I've been to, the drive-through testing areas we've been to haven't shown that long of a delay, and so there's a lot of things that go into how long it takes to get tested. What the volume is at a particular location, supplies, all of those things. We know that our supplies are getting better every day and that we're increasing our testing capacity every day. So 3 weeks sounds a little bit long to me, and so that might be for a particular testing station, but overall, I don't believe that it's taking that long to get tested.
Several reporters have asked a question along this line. Some nationwide numbers indicate that Missouri is among the very bottom of the state rankings for testing per capita, whereas Illinois next door ranks significantly higher. What impact does that have on your strategy for dealing with the pandemic? And is there any sense that eventually there will be enough tests?
Well, certainly, we would like to test more. And so anytime we can test more people, then we're able to sort of broaden our strategy for how many people we can understand how many are COVID positive out in the community. When you have less capability, then that's when you restrict who you're going to be testing, and then you're testing a lot of symptomatic people. But we know that there are people that can have very mild symptoms that we would like to get testing into. And the reason for that is so that you can then identify who those people are and do the proper isolation and quarantine. So when you look at it from that broad strategy, yes, it does impact our ability to decrease transmission because we're going to be missing some of those so less symptomatic cases that we would have been able to test if we had had more supplies to do testing. Certainly we have capacity to do more testing, but as you've heard me talk about before, it's more of a supply chain issue than a capacity issue. We know that the supply chain is improving and improves every day. Still not to where we want it to be, but it is getting better.
Is there any sense as to when that expansion of testing supplies might occur?
That's really hard to foresee. We know that over time, I think I mentioned earlier that I was out at our lab on Monday, and our directors told us they are seeing more supplies coming in. They are seeing some of that supply chain picking up, but nobody can really say like by X date, you're going to have all the supplies you want. It's going to be a gradual increase, and then don't forget that different technology will be coming online as well, and so we'll be getting antibody testing fairly soon. And then there's different types of PCR testing or the acute testing that we believe will be increasing as well. And so all of those things really will amount to more testing capability in the community, but it's hard to put a definitive timeline on by X date we'll have this much.
Missouri reported its fifth highest number of positive cases today, and it's not shown 14 days of decreased cases as recommended by the CDC guidelines. With that in mind, are you concerned that the state is reopening on Monday?
The case data is a little bit tricky to interpret, and the reason why that is because when people get tested, the majority of them are sent off to a private lab. And it takes time for people to run the tests and then report back. When they're reported back, the report comes in on the day that the report comes in. So the report comes back, then they have to talk to local public health, then it goes to the state, then it gets recorded. So there's a lot of steps that go into from the day somebody tests till it actually gets recorded. And so that's what makes it a little bit challenging to really to really understand what the trends are just based on test results, which is why we rely more on the hospitalization criteria, because it's a much more stable number and it's a more accurate reflection of what's going on in the population.
Several St. Louis County Council members are urging the county executive to open things up next week, like the rest of the state, as soon as Monday. Do you think that is a good idea?
Well, I can certainly appreciate the council person's desire to open up the economy as soon as possible, and I think everybody wants that to happen. So really the question is, do we have, and as I've said previously, do we have all of those strategic building blocks in place, as well as the decrease in transmission, in order to do it in a really safe manner? And I believe we're on the path to do that. So as I've shown you in the data, that rolling average is flattening out. We've seen a decrease in cases today, so that's encouraging news. So we believe we're on a path for that. And I know public health is working together to build all of those public health strategies or enhance the ones that they have currently. And so I believe we're getting closer every day to that reopening. But we got to make sure that all of those things are in place. As you said, as I've said before, if we move too fast with too much, we can cause that rebound. So we're just trying to be safe for the entire community, as well as not overwhelming our healthcare systems.
Thank you. That concludes the list of questions received from members of the media prior to and during today's briefing. Over the weekend, the task force will be issuing its updates via press release, and we will resume our live stream briefings Monday afternoon. Thank you.